aging, right? It's the slow functional decline of everything. Longevity is not the Brian Johnson world. When people go, I wouldn't want to be like that, I wouldn't want to be like that either, right? We want to enjoy our lives and we want to have fun. And some of the fun things that we enjoy may not be great for us. So if we can minimize it, great. And if we have to work around it, then so be it, because people want to live and they want to enjoy life.
I'm Dr. Esra, and I've been living a sober life for the past 18 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome back to Soberhead Podcast. This week, we have a fascinating conversation with Dr. Sandra Kaufmann, diving deep into the science of aging. Since we had an amazing talk, we had to divide this podcast into two sections. Here's what you will learn in part one. Instead of getting lost in countless details, Dr. Kaufmann helps us understand aging through a clear framework, the 7 tenets of aging. These tenets break down the complex process of cellular aging into manageable categories. First, we explore information systems of DNA, looking at how our genetic blueprint is affected by things like epigenetic changes, DNA damage, and the shortening of telomeres. Next, we discuss cellular energy and the crucial role of mitochondria, how its efficiency declines over time, and the impact of free radicals. We then move on to cellular pathways, examining key aging and anti-aging pathways like AMPK, sirtuins, and mTOR, as well as how they influence cellular fate. So, if you've ever been curious about the fundamental processes behind aging, tune into this episode to gain a foundational knowledge of why we age at a cellular level, with supplement suggestions for each categories. You may even find the solution to your sleep issues upon watching. Without further ado, let's dive in. Our host for this episode is .sub, the space, community, and platform where creatives, experts, and entrepreneurs come together at the meeting point of continents, the Bosphorus. Follow the link in the show notes for more information about events and membership. I'd like to thank Gedik University and Gedik Foundation for their trust in Soberhead Podcast. With their support, it is possible for us to bring you this content at this quality for absolutely free. And of course, every single one who has subscribed to this channel. However, a huge amount of people who watch Soberhead frequently are not subscribed. So, I will ask you for a quick favor. Hit that subscribe button now, because when you subscribe, it helps us make the show better and provides better access to the world-leading experts. Subscribe and share if you like. And I promise to continue to bring you a better Soberhead every day. Dr. Sandra Kaufmann, welcome to Soberhead Podcast. This is going to be an amazing podcast. I can feel it. It's going to be a wild ride, and my audience is going to be, I don't know what they would think, but some would be thrilled because you like Diet Coke like I do. Some would be like, oh my God, what type of a doctor this is. But welcome.
Thank you. It is a pleasure to be here. This is going to be fun.
So you are by training and you're still practicing a pediatric anesthesiologist, correct?
That is correct.
And you're still doing it?
Mm-hmm.
And on the side, you have a very prominent and strong longevity clinic and approach and multiple other endeavors. Would you like to talk about them?
Oh, gosh. Yeah. So I started life as a physician in the field of pediatric anesthesia. I was trained at Hopkins. I worked at a pediatric hospital in Florida for 20 years. I was the chief for about 10. Presently, I get to travel around and be an anesthesia consultant. But somewhere in those years, I decided that I was done aging. And I have a background in cell biology, so I decided that we age because our cells age. I created my sort of theory of aging. And so now what I really love to do is just sort of delve into longevity and then sort of help people around the globe. So I do have a clinic in Miami. I see patients once a month. I do a lot of telemedicine for people that can't come to me. And then I run something goofy called Club Exosome, where we do exosome therapies to people that are sort of interested in that sort of thing. So my longevity interest, business, and practice just continue to grow.
So you did plant cell biology for your undergraduate, correct?
No, actually. So my undergraduate is just in biology and chemistry, but I have a master's degree in plant physiology. So I spent a lot of time looking at cells, and granted they're plant cells, but a lot of it is just extremely similar. Like chloroplasts are just basically backwards mitochondria.
And also probably knowing so well the plants, you're able to really understand what these supplements, which is mostly plant-based, does to us. All right. So as I said, you have I don't want to say really different approach, but you're looking to longevity or living longer or healthier, whatever you want to call, just solely from a cellular perspective. Correct?
Correct.
And therefore, you're not really bothered with general suggestions, such as using some gadgets or doing some big interventions. You have 2 books. One is here. It was very difficult for me to understand. I was just like flipping it, and I'm like, oh my God, I need a whole translation of the language, not English to Turkish, just like straight up, like the technical terms. But how did you start? What made you decide to get into the field of longevity?
So, I mean, it sounds really silly, but I've always been an athlete, certainly not an Olympic athlete, but just very athletic-y. And I was a rock climber for many, many years. And I remember I was in my mid-40s. And I was hanging off of a cliff because we were trad climbing, where you sort of go up and up and up and up. And something like you're in a harness with ropes and the whole 9 yards. And I was actually starting to feel a little old at 45. And I thought, oh my God, I've got to fix this, or, I'm either going to go plunging to my death at some point, or I'm just going to get old and crotchety and be miserable. And the age is when you start feeling like you can't keep your muscle mass as well, or your vision starts to go. And it was just really sort of a hit at home moment, like, oh my God, I need to do something. And the problem at the time, because this was, God, years ago, there were no answers. Longevity wasn't a thing. If you really dug into like true scientific literature, there was like a random reference to the hallmarks of aging, but no one was talking about cellular aging. If you picked up People magazine, it would say, take some vitamin E. That was about it. And from a completely selfish point of view, I thought, you know what, I am going to figure this out. And I became the laughing stock of my family and my friends for the longest time, because they're like, number one, they've been trying to figure out how people age for like hundreds of thousands of years. Like really, you're going to figure this out? But I was determined. So I figured, why the hell not? What have I got to lose? And I set out on this journey to figure it out.
So if you would like to give a description of your understanding of a healthy aging, longevity to my audience, Turkish audience, how would you describe your treatment modality, your approach?
Sure. So that's such a broad question, how to start. So I think that aging, right, it's the slow functional decline of everything. And some things appear more quickly than others, right? People mostly in their 40s start using reading glasses. Their hair's not as good. You're gaining weight with the same exercise. These are standard aging things that everyone says, oh, you can't stop them. But when I tried to unravel all of this, I came to the conclusion that your tissues fail because your cells fail. At the heart of everything, we are made out of cells. And if you can dissect a cell, you can figure out what goes wrong over the course of time. And depending on where that cell is sitting, it will tell you what tissues die first. The easiest example is menopause. I am convinced that a huge part of menopause is energy failure, because the female productive system has more mitochondria in their cells than any other cells, with the exception of maybe the retina. So menopause is energy failure. And if you increase the energy production of the possibility, you can stave off those sorts of symptoms. Were you able to manage that for yourself? Yeah. Oh, without a doubt. Oh, yeah. So if you look back at the basics of a cell, right? And I sat there, my office looked like, random pieces of paper everywhere. It looked like a disaster. But I went through 1,000, if not thousands of research articles dissecting cells and coming up with why they fall apart over time. And some of them seem correlated and some of them were completely not correlated. So they ended up in 7 piles over the course of the years that it took me to figure this out or to determine that this was my theory. And so they fell into what I call the 7 tenets. And I can explain that if you want. Sometimes it's a little boring, but
how about this? We explain, but after each tenet, maybe we can give some examples of like more details instead of like, just go through.
Sure.
And let's also explain the audience if they do not, because we're going to translate, but it would be nice for them to understand what tenet means.
Okay. So they're just categories. They're just simply like silos, I guess you will, of cellular processes. So the first system or process in a cell that goes wrong is parts of your DNA. So like the brain of your cell. And more specifically, within the nucleus, within your DNA, 3 bad things essentially happen. And there are more than that, but I like to look at the 3. So one of which is the telomeres, which are the ends of the chromosomes, get shorter and shorter over time. So that's problem 1. Problem 2 is something called epigenetic changes. And these are different chemical groups that get put onto or taken off of your DNA that cause the DNA either to get produced appropriately or not. And epigenetic changes explain why identical twins look different as they get older, because it's how the environment affects your DNA. That's epigenetics. And then the third thing in this category is something called heterochromatin distribution. And that is essentially how your DNA gets packaged within the nucleus over time. And it turns out that you have less and less of it, and it's very disorganized. And that means that as your DNA is sort of more open, things get produced that shouldn't get produced, and it leads to cancer, essentially. So if you can sort of harness or start controlling those 3 aspects of your DNA, you reduce relative risk of all disease and then death.
At what age it starts declining?
So that's a good question. I like to think that aging starts at 35. Some people will say earlier, some people will say later, but, because everyone's going to be a bit different, but statistically, 35.
How do you measure what you just described? Because, if you're only solely focusing to all these cellular activities, it's much difficult than looking to IGF-1 or, any other blood marker.
Right. So so you can have your telomeres measured. The problem with that is that, so they tend to do it off of cells, either white cells or, swabs from your mucosa. And it's an average number that you're going to get. Different tests will sort of give you different results. So if anyone wants to check your telomere length and then recheck it over the next several years, you need to make sure you use the same company, the same cell type, and the same way that they process it. So it gives you an idea, but I would argue that it's not exactly accurate. Plus, telomeres from your kidney cells are going to have a different length than your liver cell versus your brain cell because they're just under different stressful physiologic environments. So you can measure your telomeres, but I don't actually have my patients do it because it's kind of a waste of money unless they're curious. On the other hand, you can have your epigenetics measured. This is sort of cool. Steve Horvath in the 70s came up with the Horvath clock, and you can measure which aspects of your DNA get hypermethylated or hypomethylated. That was the beginning of the epigenetic clocks. Now they are extremely complex. There's several companies that do it, and having your epigenetics measured will, in fact, give you a good idea of your physiologic age.
Which one are you using?
There's so many of them, and I have, I sort of pick and choose. I swear every 6 months there's a new one that comes out. So the answer is I don't want to give you any actual company name.
No, do not, because I had my fair share on them, and I kind of do not trust them because, the same dates, the same minute, back to back to same companies, 2 tests next to each other.
Very different.
down. Yeah, exactly.
You know,
So
and
it's
it can. And it's what's really interesting is we are at the beginning of all of these tests. They're not standard. It's not like go get your glucose tested or your cholesterol tested. This is very, very specialized stuff. We're at the beginning. 5-10 years, someone will have figured all of this stuff out. For now, the studies are there, but I don't rely on them at all. You just have to make assumptions that these things are going on, which some people don't mind and some people it bothers.
And then based on for the DNA repair, do you have I know it's in the book, but do you have a bunch of supplements or medications that you straight up gives if the person comes to you 55 years old, rather healthy looking, but you're assuming that they would have some DNA damage? So you start with some things.
So interestingly enough, when you talk about DNA damage repair, that's actually a different category. Because there are actually 5 systems to fix your DNA, and you can upregulate those, which is kind of fun. But when you talk about, so getting back to sort of tenet 1, if you're talking about telomere length, because that's probably the easiest example, there are some things, in fact, that are designed to increase your telomere length or the health of your telomeres. TA65 is pretty good. Astragalus is pretty good. Defy Time is pretty good. And these are all Bill Andrew products. So he's a good friend of mine and he's just a genius. But the one that I actually have started using is lithium.
Yeah, I heard that, and I was just like, oh my God. And I mean, I heard that, and I heard your explanation as well. But you're using rather a high milligram, and you're using the pharmaceutical.
Well, but the answer is I'm not, because so as a physician, right? And to help your audience a little bit, we give people lithium for personality disorders, usually depression or bipolar disease. And the lowest dose that one starts with to actually treat someone for that is 300 milligrams. And most people end up at 600 or 900 milligrams. So by reducing it, so I take a quarter of the lowest dose, which is 75 milligrams. So in my thought process as a physician, I don't think that's a high dose.
Okay, and is it the same if you take, let's say, 75 milligram of the supplement lithium versus the pharmaceutical?
I trust the pharmaceuticals because they've been through the pharmaceutical trials. I think they're cleaner, and I think the milligrammage is more on point. That being said, there is no study yet that demonstrates that taking lithium will increase your telomeres. People are like, oh, I want to study. It's all indirect evidence. And the idea is that they know that people that are bipolar have statistically shorter telomeres. And they know that bipolar people on lithium for more than 2 years have statistically greater telomeres. There's no study of a normal human being without that disease process on lithium for greater than 2 years looking at telomere length. Because no one's doing it except me.
You mentioned also epigenetics in the first category, correct?
Yeah. Yes, absolutely.
Yeah, you're able to reverse epigenetics just by your prescription medications and supplements?
Absolutely. Absolutely. So epigenetics is basically, it's how we control our DNA. And some epigenetic changes are minute to minute, hour to hour, and some last generations. It's what's really interesting from a generational standpoint. There were some studies that looked at women that were pregnant during World War II. And they were clearly undernourished, right? And somehow that information got put onto the genetic code of their children and their children's children. And so that the grandchildren of these starving women have a propensity to be overweight and diabetic with cardiovascular disease because their genes are programmed to suck onto every possible calorie, right? So it's just a really sort of interesting preponderance. So what you do when you are pregnant may affect generations to come. In terms of your own epigenetics, we know that like smoking, cocaine, heroin, all of those horrible things leave epigenetic signatures on people. It changes the way your cell processes genetic information. On the other hand, we also know that there's some really good things that help your epigenetics. Broccoli, which called sulforaphane, or green tea. There are just a lot of polyphenols as good examples that are just extremely beneficial to the health of your epigenetic signature.
would these compounds or more or other compounds would equalize the damages it's been done or still keep doing? Let's say if someone keeps smoking, can you give them something that would at least balance the damage?
That's an excellent question, and no one's ever tried to do that. It's an excellent question. Although it's really funny. So I have one client, actually she's Russian, she's hysterical, and she loves to vape. She will not give up her vaping, despite the fact that I have I'm like, you can't, it's just a really bad idea. However, we have built protocols around trying to reverse the effects of her vaping. I don't know if we can pull it off or not. But if you look at all of the problems that these bad habits cause, theoretically, you can go, okay, well, we're going to, sort of treat that with something going in the opposite direction. Does it work? There's no way we're truly measuring it, but it can't hurt.
But there are certain other stuff that I know that you're able to measure, and you're doing it for yourself, because I think like the sugar consumption.
Oh, yeah. But that's a whole nother tenet.
What I'm trying to say is that there are certain ones that you're able to know the damage. You don't need to measure or anything, but there are some others like cocaine or cigarettes, smoking and whatnot. It's not really there. You're assuming which organs and whatnot it's affecting, and therefore you're giving the treatment. Mm-hmm. That's wonderful. Yeah. I'm sure that, they're going to be, after listening to this podcast, I wouldn't be surprised if there are so many Turkish people knocks on your door because they smoke. It's a smoking country.
So smoking is actually a really interesting example, because not only is it bad for your epigenetics, right? Mm-hmm. It produces so many free radicals. So you have to separate what does smoking do. There's the toxins, and then there's the radicalization, right? So I think there was some deal where one puff of a cigarette is like 1 billion free radicals, and that just wreaks havoc on your body, which is why it sort of leads to inflammation and cancer. So those people, if you don't want to stop smoking, right, you have to be massively into free radical scavengers. So I put them on astaxanthin, which is an oil-soluble free radical scavenger. I put them on some sort of water-soluble free radical scavenger, of which there are several possibilities. But yeah, people do come to me with their sort of bad habits, and we like, oh, okay, well, let's work around your bad habit and see what we can do to fix it.
I think what's great about you, that's what I was really looking forward for this interview, that you're not like, oh, you need to stop this. More like you're saying, okay, if this is your habit, let's try to figure out a way to compensate that.
Yeah, why not? Right? Because longevity is not the Brian Johnson world. He's a lunatic. His entire life is longevity, right? And he take the blood of his children, and he never sees daylight. He does nothing fun unless the computer tells him that it's okay, right? That's not living.
I just cannot stop laughing.
It's horrible. When people go, I wouldn't want to be like that. And I wouldn't want to be like that either, right? We want to enjoy our lives, and we want to have fun. And some of the fun things that we enjoy may not be great for us. So if we can minimize it, great. And if we have to work around it, then so be it, because people want to live and they want to enjoy life while living better, right?
Yeah, that's great. So let's go to Tenet 2. I guess that's now the time for that.
Great. So Tenet 2 has to do with energy production. So this is mitochondria. And most people hopefully remember from the 5th grade, mitochondria is that little organ that sits inside. It's the double membrane, and it's a little squiggly thing that looks like a bean. And what's interesting about mitochondria is that once upon a time, billion years ago, they were their own freestanding cell. They're really good at making energy, but they got sort of sucked into these bigger cells that weren't so great at making energy, and now it's a symbiotic relationship. And as a consequence of that, right, several things sort of stick out. Number one, they have their own DNA. Right? So mitochondrial DNA is completely different than your nuclear DNA. And it doesn't have telomeres because it's round. It just circles. And different things sort of happen to the mitochondrial DNA separate from nuclear DNA. So that's issue one. And the other thing that's really interesting is that the inner membrane of the mitochondria, the lipids, are quite different than the standard lipids because they came from a different organism. So when you talk about cardiolipin, right, it's it's one of the things you have to sort of be careful with because it's not the typical lipid. So the mitochondria have like all these like sort of strange things. But if you look at it from a perspective of aging, depending on how you count, like 6, 7, 8 things go wrong, right? So and if you look at the electron transport chain, which is where energy is made, that starts failing over time. You don't make all the subunits you're supposed to make. It leaks over time, so you get more free radicals, which is bad. You get an NAD deficiency, so it doesn't work as well. So that's sort of bad. The pores or the holes in the membrane that sort of keep all of the sort of pseudotoxins in start leaking more over time. That's the mitochondrial permeability transition pore. The sort of the directors of the mitochondria, which is sirtuin 3, that sort of falls over time. So there's just all of these things that happen within the mitochondria, meaning you're not going to have the energy production that you need. As well as the other things that it does. So mitochondria also make hemoglobin. Well, they make the heme part of that hemoglobin. They make a lot of these sort of like high energy bonded sort of things. So as your mitochondrial fails, so do the tissues that require a lot of energy. So that's your ovaries, that's your retina, that's your brain. So if you can sort of reverse or at least decelerate mitochondrial failure, you do really much better.
And you start probably, one needs to really start no later than the age of 40, I guess, because, most people starts the perimenopause, your eyesight starts going bad, you cannot run as fast, yada, yada. So how do you support it?
Excellent question. Easiest things to do, number one is the NAD deficiency. And sort of like big in pop culture these days. So NAD is nicotinamide adenine dinucleotide. And it's sort of, we talk about ATP as being the sort of center of energy because that's what we make. But if you don't have NAD, you're not going to make any ATP. And this sort of sounds a bit sort of confusing. But NAD, you use more of it as you get older and you produce less of it. So you have a significant deficiency. So we're working on ways to increase your NAD supply. And there are many ways to do this in terms of intaking precursors. So you can take, for example, nicotinamide riboside, which turns into NAD. You can take nicotinamide mononucleotide, which turns into NAD. You can inject NAD straight into your body. NAD, there's no intestinal receptors for it, so if you eat it, it doesn't go into your body unless it's liposomal, and people are working on that. They're also working on patches or nasal sprays. So at the moment, there's this huge push for people to take more NAD precursors to boost levels.
There is a debate in the field. I know that too much NAD. They're like, let's try to figure out how to block that waste instead of giving more because they're afraid of CD38 and NNMET.
Right. So exactly, you want the right amount of NAD. You don't want too much. You don't want too little. If you take too much...
What do you consider too much?
So this is the problem. Everyone is different. Everyone is different. So if you have metabolic disease or if you have some sort of inflammation, you are using up more NAD, right? So it's just really hard to say. And Genfinity is working on ways of measuring it. But again, we're not to the point that you can just figure out if you have enough or not. So I do it by clinical presentation. People come to me and they're very exhausted. We get them souped up and then they've got pretty good energy and then we back off a little bit. And then that's probably pretty reasonable. Too much NAD causes negative feedback loops. So one of the metabolites is just the nicotinamide aspect. And it turns off your sirtuins and it turns off your ability to repair DNA. So you don't want too much, right? The medium amount. The other thing you can do instead of taking precursors is you can reduce utilization. And some things you want NAD for, you don't want to turn off.
Hold on. You can reduce utilization. What do you mean by that?
Okay. So we are making NAD and then we are using it for things, right?
Sure. I understood by the language. I didn't understand how does it work.
Right. So what we want to do is we want to reduce the use for things that we don't want. And you mentioned CD38, and that's perfect. So CD38 is it's an enzyme that sits usually on the top of inflammatory cells, a few others, but mostly immune cells. And it gets turned on by the inflammatory process, and it eats up NAD, so it's an NADase, and it creates more inflammation. Right? So if we can block CD38, we are blocking inflammation, and we are blocking using that much NAD in that particular category, right? Because the idea is we want to save the NAD for things that we really need it for, and we need it for 500 different reactions around your body. So we don't want to block all of them. We just want to block the ones that we don't really need. So CD38 is the perfect target. So one of the best ways to block CD38 is through something over-the-counter called Epigenin from chamomile tea. So generally speaking, if you're taking NAD, I always say cut back a little, add Epigenin, right? And then the other thing that you were talking about is if you take too much NMN and your enzymes can't sort of chew through it, you end up with axonal degeneration, meaning nerve damage. The way to upregulate the enzyme that does that is actually through green tea. So now what the combination is some NAD precursor, you've got the Epigenin, and you've got the green tea.
There's something called 1-MNA as a supplement. You know of that?
Yes. So everyone knows the money is here, right? People are spending billions of dollars in this. So everyone is trying to find some aspect either of a different precursor or messing around with the metabolism or making it more bioavailable to sort of corner the market. But in essence, you want to increase the availability and decrease utilization to hit the happy medium where you're in a homeostatic position.
You know, when I was getting ready for the podcast and, I was flipping through the pages of your book and let's say one of the molecules, fisetin. And then I went to my cabinet and looked the milligram, and I'm like, everything is like, maybe also on me, like I just choose to buy the highest potency. But, you say on a daily dose, take like 40, 50 something or 100, something like rather lower. And I looked to mine, it's like 400 milligram. I said it's very difficult to be able to manage these supplements when you buy over the counter without knowing how potent they are or not.
Oh, no, without a doubt. And so my philosophy is first you have to figure out which ones you're going to take, number one, right? Are they soluble? Are they not soluble? What's their bioavailability? So on and so forth. And then people say, well, how much should I take? And the answer is always, if you're going to take one or two things, you need a reasonably large dose to get to that goal. If you are taking many things that get to the same point and are synergistic, then you can take significantly less. So I say this publicly all the time. I take 70 supplements or adjuvants a day, but I take significantly smaller doses because I am trying to optimize the synergistic molecular effect while minimizing any potential side effects. The other thing you have to know about these doses is they are complete and utter guesses from these companies. They're guesses, and they're extrapolated from rodent studies. And then you have to, there's this whole formula of, human, from rodent to human, which may or may not be true based on solubility and volume of distribution, because that's what anesthesia is. That's what I determine, right? The other thing is that these studies are short term. Even if they look at them in humans, right? They're 2 month, 3 month, 4 months is considered a long-term study in human world, right? And if you assume that you're going to be taking these things for years, do you really need a super high dose for years? And I think the answer is no. I think you need a reasonable dose, but not an overdose.
That was good because, I listened to your podcast about NAD. And you're obviously big on NAD, big meaning you for the mitochondrial energy-wise. And it wasn't really discussed too much about people needs to be push the brake and the gas pedal at kind of the same time.
Well, and the other thing is that, there's this crazy idea out there They always say if some is good, more is better. And that's just not the case in medicine, right? Mm-hmm. There's usually some sort of optimal range, which could be different for everybody, whereby you get benefits without harm. And too much NAD, much like any other supplement, can have harmful effects. And in fact, we know that too much NAD leads to too much nicotinamide, which has negative feedback factors. As well, it gets methylated. So it sucks up all the methyl groups in your cells, which number one is inflammatory, but two, it changes the epigenetic signature of that cell. And people know this, so then they take either glycine or trimethylglycine to try to make up for it. And the answer is just don't take as much, right? I'm not saying don't take it, just don't take as much, because too much is not necessarily a good thing of anything.
So are we at Tenet 3?
Sure, let's go to Tenet 3. So Tenet 3 I call pathways. And this is the idea that certain genes that turn into enzymes and proteins control your cellular stability or how your whole body is going to function in the world of longevity. And in this pathways, I've broken it down into 4 basic things. So number 1 are your sirtuins. Sirtuins are deacetylase enzymes, and they are in every cell of your body. You have 7 of them. 1, 6, and 7 live in your nucleus. 3, 4, and 5 live in your mitochondria, and then 2 sort of flits around the cell. And they are the ultimate on-off switches of pretty much everything. You lose sirtuin activity as you hit your 30s and 40s, which means you lose cellular homeostasis. And this is why people aren't sleeping very well. It's why you store fat differently. It's when you don't repair your DNA the way you should. It's what are you going to use as an energy source, sugar versus any of the lipids. So, for example, sirtuin 3 that was in your mitochondria controls, are you going to use lipids or not? And I'm convinced that sirtuin deficiency is causing people to have high lipid levels as they get older because you're just not utilizing what you did when you were younger. Anyway, that's sirtuins.
It's very interesting, though. I didn't know this much details about sirtuins. I keep hearing it, but I didn't know that they were managing all these very crucial parts of one's system.
Oh, they are incredible. And people, I think you're right, people miss this main point. If your sirtuins are not working, all cellular homeostasis starts to fail. And you can take as many other things as you want, and you're just not going to hit what you need to. As an example, I think one of the biggest complaints that people come to me about is sleep, right? I did a circadian rhythm lecture. Sleep, right?
I raise my hand.
So as a really fast sort of recap, there are 2 proteins that put you to sleep. There are 2 proteins that wake you up, and there are 2 proteins that sort of change the oscillation cycles, right? The production of all of those is controlled by sirtuins and NAD. Specifically sirtuin 1 and sirtuin 6. So again, if you go back to the root of this, if your sirtuins are failing by the time you are 40 and you're NAD deficient by the time you are 40, your circadian rhythms are going to fall apart. Thus, you are not sleeping. And while you are sleeping, there's something called clock control genes. And so this cycle controls essentially 40% of your genome. So if you are not sleeping, not only are you tired, but the 40% of your genome that controls DNA repair, protein repair, sort of memory compaction, all of those things are lost if you are not sleeping. So everyone talks about the Zeitgeibers of sleep, blue light filters, don't watch TV, don't eat before such and such, drink less caffeine. None of that is the true problem. The problem is sirtuin deficiency. So as soon as I get people on the correct balance of sirtuins and NAD, and maybe a few of the other things involved in the circadian rhythm, those issues go away.
Can we just stay a little bit more on this topic? Because I never did a program about sleep. Obviously, we're not going to get into too much details, but so...
It's a bit.
I don't even know how to formulate it, because so if someone has enough NAD, but then lacking sirtuins, it seems like it's even worse because you have the energy, but you don't have the shut-off valve.
Right. So it doesn't exactly work like that.
I kind of am analyzing myself.
No. So let's go back to NAD for just a second because this may help. So NAD, the activity of NAD falls into two basic buckets, right? Bucket one is in the mitochondria for energy production. Sure. And it's in the electron transport chain, it's in the mitochondrial matrix, it's in glycolysis, right? If you don't have NAD, all of the energy systems fail. That, all right? But within that topic, or within that category, we're not destroying the NAD molecule. We're simply shuffling protons around. So it's NAD, NADH+, et cetera, et cetera. It just goes back and forth. We're not breaking down the molecule, right? So that's bucket one. Bucket two is the 500 enzymatic reactions that it takes part in around the body. And in this sense, we are taking the molecule apart. So we're utilizing it, right? And this bucket are sirtuins. Right? We disassemble the NAD molecule to use it in the sirtuin process. We disassemble it in PARPs to fix your DNA. So this is where we are using it up, literally breaking the molecule to pieces. All right. So when your body has to decide then, well, if I'm short of NAD, what's going to happen? Well, it turns out it has to do with binding affinities, right? What system pulls the molecule closer to it? And sirtuins lose. Like if there's a PARP and a sirtuin like pulling on like the last remnant NAD, sirtuins always lose, which translates into the idea that you are going to lose cellular homeostasis before all else, right? And we know this if you look at people because they complain about all of those things first. This is the I'm gaining weight. This is the I'm not sleeping. That's why, right? So if you add back the basic aspects of the cellular biology, cells work better, so organs work better, so your physiologic being as a whole is better.
Let me give you a little information about myself. I do have a sleeping problem. I think that I messed it up while I was doing drugs. I will be 19 years sober like next month. It gets worse by the year. Worse meaning like, in the morning I wake up energized, but I have the energy, but I wake up like 7 times a night.
Yeah.
It's just like every freaking hour. Then I said, like, let me do a sleep study. I paid tons of money, did a sleep study. There was, thank God these days, they're like home done tests, but you still attach bazillion stuff. They couldn't find anything. And then the guy turned to me, and he's a Harvard fellowship guy. It's like, that might be psychologic. I said, like, I mean, I did the stellate ganglion block. I did this, I did that. Nothing is changing. I take a bunch of medications. I'm able to fall asleep. And after I listened to your talk, I'm like, it seems like there might be something missing. And it seems like there's a way to replace that.
Yeah, there is. Because if you don't make the 4 essential proteins, you're not going to sleep. Like melatonin, for example, starts the process and it will put you to sleep if that's something people do, or benzos or whatever it is. But in order to stay asleep, you have to make these 4 proteins, right? It's clock and BMAL1 put you to sleep, and period and cryptochrome wake you up. That's just what happens. And then you can sort of play around because then there's 2 enzymes. There's reverb and ROR alpha, and one's an agonist and one's an antagonist. So it changes sort of like the oscillatory pattern. But if you don't have that at baseline, you're not going to sleep.
Are these measurable, or this is based on anecdotal description of the patient?
So if you were in a lab, or if you were a lab animal, we could measure it. If you were in a, no, I'm serious. I mean, because there's 1,000 studies of rats in there, whatever. The funny thing is, they had to design a special rat because rats are nocturnal and we're not, right? So you either have to flip a regular rat, or they built a rat that was on our time cycle to figure it out. But you could, if humans have been in many studies where they can measure these things, but you can't go down the block to, Joe Schmo blood testing and have these things tested, because it's just, again, this is all very fashion forward ways of thinking about medicine.
What do you use for your clients for if they are lacking these 4 proteins?
So you can upregulate them. So the first thing is the sirts, so 1 and 6. So choices for sirtuin 1 is pterostyl or resveratrol. Those are the big players. There are a few other ones, but those are the big players. Sirtuin 6 gets activated by fucodan, which
what's that?
So it comes from algae. It comes from seaweed, actually. It comes from brown seaweed. Best ones are from Japan, Korea, sort of like the Asian areas. So that's sirtuins. And then, of course, your NAD levels to be appropriate. And then you can add things. So you can play with ROR alpha agonists. The best one is nobiletin. That comes from orange peel. And then there's other things that are just known to help. For example, selenium is known to help. That's quite useful. And then there's just a few other sort of like random things, but most people do really well on that.
And is there, now that I'm asking personal stuff, I'm going to probably order them. Nobiletin, orange peel, you said. Obviously, eating oranges are not going to be enough. But, so it's a supplement. I looked up to it after listening to one of your talk. Actually, you did speak about that with Dave Asprey as well. And is there a level, like take 200, 500, 1,000 milligram or... So
the problem,
or you try, you keep trying.
We don't know. The answer is we don't know. I usually start people on small amounts, and then we just sort of increase them until they're happy. And the other thing is, sleep is really funny because the longer people haven't slept, the more anxious they are. And now I'm not fighting physiology; I'm fighting the anxiousness of not being able to sleep. So sometimes it's the combination of lithium, which chills you out a little bit, and all of these things. And then people they sleep like zombies. It's amazing. So, right? But there is people come to me and they're like, they are so stressed out about not sleeping that even if I put a tranquilizer dart in them, they would just still be stressed out. So the answer is I try to tell them to take off your damn Oura ring because that's stressing you out. There's these men that compare their sleeping data as if it's some sort of testosterone spitting contest, right? Who cares what your ring says? Are you getting the rest that you need? So I tell you, reduce the stress, reduce the anxiety, take the mental component out of it. Let me fix your cells, and then people sleep. And it works.
It's almost like, somebody told me I might have some sleep PTSD. I don't care anymore. I wake up a bazillion times and, I go back to sleep. I'm able to fall back to sleep, thank God. But, it's just and my mom is like that. She every morning, our first call is she goes I couldn't sleep again. I said, Mom, you're not taking anything. You're complaining about it. So she goes like this for 4 nights, 5 nights. And then boom, the 6th night she sleeps because she's very tired. But, these are very important notes, and people are I'm receiving so many private messages because people knows about my sleeping kind of problem. I don't care anymore. And they're like, were you able to find something? Please tell us. Now they're going to have it in this episode. Thank you so much for that. So, all right. Are we moving to the 3?
So really quickly in the pathways still. So there's sirtuins, there's AMP kinase, and mTOR. And this is sort of an interesting thing because they measure how much energy you have and then either turn things on or turn things off. So AMP kinase measures, so ATP is the energy currency and AMP therefore is the lack of it. So it's adenosine mono versus triphosphate. Anyway, what's really cool, and this is why I'm mentioning it, is so this is why the caloric restriction diets are one of the reasons that the caloric restriction diets sort of work. Because if you tell your body that you have no energy, right, it turns on AMP kinase, and that activates a series of cellular pathways to precipitate longevity. mTOR is the opposite of AMP kinase. What mTOR does is it senses energy and it says, oh my God, we're going to build things. We're going to make more proteins. We're going to do this. We're going to do that. We're going to do the other. And it takes a lot of energy. And it's the opposite of we're just going to hibernate for a little while and last longer. So if you block mTOR, you do in fact improve cellular status to a certain degree. My problem with it is that you're also blocking the ability to turn over fast cells. So for example, hippocampal turnover is super fast, intestinal wall, super fast, red cell turnover, right? Super fast. So I do not believe in totally turning off mTOR, which is what rapamycin does. I believe in partial turning it off. So by using AMP agonists, they actually serve as mTOR antagonists.
So even pulsing rapamycin is the same thing for you, like once the protocol is, I think, like 4 or 6 milligram once a week.
Right. And so people are trying to figure out, right? I think it's terrible for you. But well, that's not true. It has its good points. It has its bad points. And people are trying to figure out, well, if you just take a little, what happens? Right?
Oh, that's the reason.
Right. So there's a game. Otherwise, they'd say take it every day. Everyone knows that's a really bad idea. But we don't know. Is taking a little bit on one day of the week, is that good enough? Is it still terrible? We don't know. And I consider myself reasonable. I used to think that of myself as old. Now I'm like, I'm reasonably young compared to where I am going. And therefore, if there's any relative risk to my fast turnover cells, I'm not willing to do it. So I don't take rapamycin.
And you have what to take instead in your book?
Oh, there's lots of choices. Absolutely.
Okay.
Anyway, so that's sort of pathways. The next category is what I call quality control.
Interesting.
And
good name.
Well, this is the idea that if our cells are factories, sometimes things don't always get made the way they should, right? Things break. So this is DNA repair mechanisms, of which there are 5. These are protein repair systems, proteostasis, right? And then when you can't fix things, you recycle them. So that's autophagy. There's all sorts of fun things in this category. So heat shock proteins. Heat shock proteins are like, oh no.
I know what you're going to go with, and I have it from Japan.
Oh, yeah.
Because I hate sauna and cold baths. So I just like, okay, continue, please.
So funny. So you already know everything.
No, I don't know, but I mean, I'm using it. So
I know someone in Japan probably woke up one day and said, why in the world did this drug now take off? Like, why is everyone...
To Turkey, to America,
right?
To everywhere in the world.
They're like, we have no idea how this happened, but everyone now loves this drug. So briefly for your listeners.
Yeah, please.
So proteins work by 3-dimensional activity. Like it's like putting a block into a puzzle or a puzzle piece. It has to maintain its 3-dimensional shape or it doesn't work. And when proteins are under physiologic stress, either too hot, too cold, too acidic, too this, too that, they lose structure. So the body knows this. So when the body senses a state whereby the proteins are going to fall apart, it sends in chaperones, basically babysitter proteins to keep them in their 3-dimensional shape. So this is why people sit in saunas. Number one, it feels good, right? And they're emotionally whatever, and they sweat and whatever. But they are upregulating their heat shock proteins, right? So it's heat and they're protecting their proteins. And it works. But as you well know, there are drugs that do the same thing. So
is it like exactly the same thing without, you don't need to get into the sauna or cold bath or anything if you don't enjoy? I don't think it's doing anything else besides like people's psychological endurance, which I am not willing to try myself, to be honest with you. Can you explain a little bit more about the heat shock protein? Because now I understood why it's important. But so basically what it does is like when you're performing these contrast to the body stuff, let's say, then body sends these chaperone proteins. Therefore, it also helps to not the protein folding from the reaction to the, let's say, cold water, but also to the rest that is affected by neurological disorders or anything else. So basically, it's kind of targeting everything at that point.
So basically, it's just forcing proteins to stay in their 3-dimensional shape, right? So a protein has to be, we call it folding, or sometimes things they unfold and then they go back together and they misfold. And the root of a lot of neurologic disease is misfolded proteins. And we call them Lewy bodies, or in Alzheimer's, it's amyloid plaques. But these are all proteins that were made for a reason, a different reason. Their three-dimensional structure changed and they globbed together and they're causing problems. So by increasing the babysitter proteins to keep these proteins separate and folded the correct way, these proteins can do what they were supposed to do without causing any detriment to the cell. And there's only one study that I could find, and they compared if you had mild, moderate, or severe Alzheimer's, and they stuck them on heat shock protein activators like the Cellbex we're sort of referring to, demonstrated that if you had mild Alzheimer's, it would reduce the progression of the disease. But if you already had Alzheimer's, it wasn't going to make it any better.
Are you doing it daily, the Cellbex, or are you just pulsing it?
No. So I actually do it daily. I take, so I think the dose for the big clinical studies was like 400 milligrams. And I think that's ridiculous because they want to show a difference in a very short period of time. So if you think about what we're going to do, in a long version or like for one's lifetime, I take 50 milligrams a day.
I think it's in the package there, 50. You know who spoke about it? Dr. Joseph Purita.
Really?
He was he actually, we're airing within the couple of hours.
I wonder if he got that from me, because it took me a long time to find that. Like, I didn't see that in any literature. I mean, I didn't see it in any popular literature. I dug that sucker out of an esoteric journal from God knows where. So I wonder if he borrowed that idea.
No, because he says that they're using that besides all the other things. I said, I shared it in the program. I said, I heard this from Sandra Kaufmann. And I was looking for, how can I find that? And he sent me the invoice from the Japanese online pharmacy thing, and I ordered it. It comes pretty fast to New York, actually.
Yeah. And I buy it in bulk. Yeah. And they're really cute. They're like little green things.
Yeah.